A patient is seeking an herbal solution that produces an effect similar to estrogen. What herb should the nurse suggest the patient investigate? A. Cat's claw. B. Black cohosh. C. Feverfew. D. Milk thistle. The answer is B. Black cohosh. Black cohosh produces effects similar to those of estrogen. The patient is curious about behavior therapy, and asks the nurse. The nurse would best describe behavior therapy as A. A therapy that makes use of physical and social environments. B. A therapy that makes use of a group dynamic. C. A therapy that achieves results through conditioning. D. A therapy that makes use of relationships and personal connection. The answer is C. A therapy that achieves results through conditioning. Behavior therapy is a therapy that achieves results through conditioning. The therapy aims to reinforce desired behaviors and eliminate undesired behaviors. A patient is seeking an herbal solution that improves microcirculation in the eyes. What herb should the nurse suggest the patient investigate? A. DHEA. B. Peppermint oil. C. Bilberry. D. Aloe. The answer is C. Bilberry. Bilberry improves microcirculation in the eyes. Which of the following herbs aids in wound healing when applied topically? A. Red raspberry leaf, Robustiaeus. B. Hawthorn berry, Crocus ssp. C. Yellow dock, Rumex crispus. D. Calendula flower, Calendula officinalis. The answer is D. Calendula flower, Calendula officinalis. Calendula flower contains fardiola and the fardiol monaster, powerful anti-inflammatory and anti-edematous tryptanoids, which have shown effects comparable to indomethacin. Yellow dock is as a laxative. Red raspberry leaf is a vasodilator, and may exacerbate inflammation. Hawthorn berry can be used to ameliorate symptoms of congestive heart failure. Which of the following herbs contains a compound similar to lovastatin? A. Nettle, Urticularia. B. Kava, Piper methysticum. C. Red yeast rice, Meniscus purpureus. D. Lavender, Lavandula. The answer is C. Red yeast rice, Meniscus purpureus. Red yeast rice contains monocolins, which block the production of cholesterol. Monocolin K has the same structure as lovastatin and functions similarly to reduce cholesterol. Nettle is best used as a painkiller, and to treat disorders of the excretory system. Kava is a sedative and anesthetic, and may also be used to treat social anxiety. Lavender has a calming effect, and is effective in inducing sleep. Which is the most common homeopathic remedy for mild otitis media in a child that is weepy, clingy, and refuses fluids? A. Belladonna. B. Pulsatilla. C. Sepia. D. Arsenicum album. The answer is B. Pulsatilla. Pulsatilla is most often given for otitis media when the child is clingy, weepy, refuses fluids, and wants to be held or carried. They may be hot or sensitive to heat and desire fresh air. Belladonna may be used as a pain reliever, and an anti-inflammatory remedy. Arsenicum album is commonly used to treat anxiety and gastrointestinal inflammation. Sepia is most often used to treat female reproductive-related ailments. Which of the following hydrotherapy treatment might be most beneficial for a repetitive stress injury? A. Warming socks. B. Hot fermentation. C. Infrared sauna. D. Hot and cold contrast therapy. The answer is D. Hot and cold contrast therapy. Hot and cold contrast therapy consists of submerging the painful joint in hot water for 5-10 minutes, then submerging it in cold or icy water for 30 seconds, then back to hot for 3 cycles. This treatment reduces pain and inflammation and is common in sports medicine. Infrared saunas use radiation to heat the sauna, rather than typical saunas, which primarily use convection. Both are effective for pain relief and relaxation. Hot fermentation can be used to decrease swelling and provide relief from pain due to menstrual cramps. Warming socks are used as a hydrotherapy treatment to increase circulation and raise body temperature, which can help when fighting infection. Which of the following homeopathic remedy is indicated for acute urinary tract infection with intense dysuria and frank hematuria? A. Bryonia. B. Meterinum. C. Canthres. D. Calcarea carbonica. The answer is C. Canthres. Canthres is indicated in urinary tract infections with frequency, dysuria, and frank hematuria. Patients may also experience flank or back pain, restlessness, and anxiety. Bryonia is used for pains associated with cold and flu. Meterinum has been used to treat urethral discharge in male patients with gonorrhea. Calcarea carbonica can be used to treat physical fatigue and muscle atrophy due to malnutrition and/or infections such as mononucleosis. Which of the following homeopathic remedy is most commonly indicated for post-streptococcal glomerulonephritis? A. Natrum sulfuricum. B. Palladium. C. Apis. D. Berberin. The answer is C. Apis. Apis is the most common remedy given for post-streptococcal glomerulonephritis. The patient may be restless and heat intolerant. Other common symptoms are back pain worse in the area of the left kidney and pain or pressure on stooping. Berberin may be used for heart failure, skin burns, and some bacterial infections. Natrum sulfuricum is used to treat liver and gastrointestinal problems. Also, it may be used for headaches and asthma. Palladium may be used for headaches too. Which of the following herbs has hypnotic, sleep-inducing, properties? A. Licorice, Glycyrrhiza glabra. B. Chicory, Cicoria mindibus. C. Passion flower, Passiflora incarnata. D. Golden seal, Hydrastis canadensis. The answer is C. Passion flower, Passiflora incarnata. Passion flower has been studied widely for its uses as a sleep aid. It is also anxiolytic, and has been used to treat abdominal pain and GI upset, arrhythmia and hypertension, and topically for burns and hemorrhoids. Note, passion flower is not safe in pregnancy as it may stimulate uterine contractions. Chicory can be used for its toxicity to internal parasites, namely intestinal worms. Golden seal may be used as a remedy for the common cold and/or upper respiratory infections. Licorice may be used to treat inflammation of the gastrointestinal tract. Which of the following mind-body practice has been shown to increase both T cells and natural killer cells? A. Yoga. B. Meditation. C. Music therapy. D. All of these. The answer is D. All of these. All of these mind-body therapies have been shown to increase the activity of natural killer cells and cytotoxic T cells. Which is the most common homeopathic remedy for acute otitis media which starts suddenly, where the tympanic membrane is hot and bright red and the child is restless and anxious? A. Nitrum muriaticum. B. Belladonna. C. Pulsatilla. D. Sulfur. The answer is B. Belladonna. Belladonna is the most frequently given remedy when otitis media is sudden onset, bright red and hot, and the child is restless and may be confused, anxious, or frightened. Pulsatilla is used to treat reproductive pain in both men and women, and for migraines. Nitrum muriaticum is more effective as a remedy for chronic, not acute, disorders. Sulfur is most effectively used on the skin and eyes to treat irritation. Which is the most common homeopathic remedy for acute gastroenteritis, food poisoning? A. Graphites. B. Arsenicum album. C. Platinum. D. Belladonna. The answer is B. Arsenicum album. Arsenicum album is the most common remedy given for acute gastroenteritis with vomiting and diarrhea, especially when diarrhea and vomiting happen simultaneously. Diarrhea is in small amounts constantly throughout the day, and the affected person is experiencing chilliness and marked tenderness in the abdomen. Graphites are most commonly used to treat skin disorders. Platinum is used to treat a range of psychological and physiological aspects of women's health. Belladonna may be used as a pain reliever, and an anti-inflammatory remedy. Which of the following herb has been used effectively to decrease both Candida overgrowth, thrush, vaginitis, and dysbiosis, and Epstein-Barr virus infection? A. Milk thistle, Silybum marianum. B. Licorice, Glycyrrhiza glabra. C. Red yeast rice, Meniscus purpuris. D. Berberin, found in Oregon grape and golden seal. The answer is D. Berberin, found in Oregon grape and golden seal. Berberin has been used alone and in conjunction with fluconazole to successfully treat fluconazole-resistant Candida infections. It has also been shown to have an inhibitory effect on Epstein-Barr DNA replication. Red yeast rice may be used to lower cholesterol. Glycyrrhiza glabra can be used to decrease inflammation, and cough, and to promote ulcer healing. Milk thistle is used as a remedy for hepatic disorders. Which is the most common homeopathic remedy for any kind of blunt trauma followed by a state of dullness and shock? A. Pulsatilla. B. Nux vomica. C. Semicifuga. D. Arnica. The answer is D. Arnica. Arnica, a herbaceous plant, is the remedy most often used for states of shock after an injury, during which the injured person may refuse medical help due to fear of further injury. Pulsatilla is a plant that may be used for pain in the reproductive organs, restlessness, and other ailments. Nux vomica seeds may be used for gastrointestinal discomfort, anemia and erectile dysfunction. Simicifuga is a plant that may be used to alleviate neurological disorders. Which of the following herbs can block thyroid-stimulating hormone, TSH, receptors and decrease peripheral conversion of thyroxine, T4, to triiodothyronine, T3? A. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm. B. Z-maize, cornslick, and Sambucus nigra, elderberry. C. Berberis vulgaris, barberry, and Epimgraviolens, celery. D. Panax ginseng and Symphytum officinae, comfrey. The answer is A. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm, have both been shown to inhibit conversion of T4 into T3 in the peripheral tissues, and have been used to treat mild cases of hyperthyroidism. The other herbs listed have no specific effect on peripheral thyroid hormone conversion. Berberis vulgaris is used to treat respiratory conditions, and infections such as the cold and flu. Epimgraviolens has been used to treat pain. Panax ginseng has been used as a stimulant, and to treat sexual dysfunction in men. Symphytum officinae has been used to treat gout, and disorders of the gastrointestinal tract. Z-maize may help treatment of skin diseases. Sambucus nigra is best used to treat upper respiratory infections. Urticularia, stinging nettle, leaf is used for all of the following except dash. A. Anti-inflammation. B. Psoriasis. C. Nutritional support. D. Allergic rhinitis. The answer is B. Psoriasis. Urticularia, stinging nettle, leaf extract contains antagonists of the histamine 1, H1, receptor, thus decreasing symptoms of allergic rhinitis and sinusitis. Nettle leaf extract also contains factors that inhibit mast cell tryptase, preventing degranulation and release of a host of pro-inflammatory mediators that cause the symptoms of hay fevers, and inhibits cyclooxygenase 1, COX-1, cyclooxygenase 2, COX-2, and hematopoietic prostaglandin D2 synthase. As a nutritive, nettle leaf is an excellent source of vitamin A, vitamin C, iron, and calcium. Nettle leaf has shown no benefit in treatment of psoriasis, though it may help to correct any underlying nutritional deficits. Which botanical is known for its antiviral, antiretroviral activity? A. Crataegus spp, hawthorn. B. Avenus sativa, milky oat seeds. C. Melissa officinalis, lemon balm. D. Hypericum perforatum, St. John's wort. The answer is D. Hypericum perforatum, St. John's wort. Hypericum perforatum, St. John's wort, has shown significant antiviral activity against a wide variety of enveloped viruses and retroviruses. Melissa officinalis, lemon balm, and Avenus sativa, milky oat seeds, are both better known for their sedative effects, and Crataegus spp, hawthorn, is used as an antiarrhythmic and mitigates oxidative stress in cardiomyopathies. What antimicrobial constituent makes Artistophilus ursi useful for treating urinary tract infections? A. Tannins. B. Hydroquinone glycosides. C. Flavonoids. D. None of these. This herb is not used for urinary tract infections. The answer is B. Hydroquinone glycosides. Uva or C contains the hydroquinone glycosides arbutin and methylarbutin, both of which have shown significant antimicrobial effects in the urinary tract. The other constituents listed have no effect on urinary infections. Which of the following homeopathic remedy is indicated for irritable, colicky infants who cry frequently and arch their back and who are only soothed by bouncing or pressure, such as swaddling? A. Arsenicum album. B. Arnica. C. Chamomilla. D. Calcarea carbonica. The answer is C. Chamomilla. Children needing chamomilla are hot, irritable, and very sensitive to pain. Infants are prone to colic and gastroesophageal reflux disease, GERD. They will often arch backwards when crying, and will be soothed when bounced, carried, patted, or swaddled. These infants experience difficult dentition and will chew their fingers before teething. Arsenicum album and Calcarea carbonica are both more often indicated for chilly babies that are prone to anxiety, while Arnica is generally given for people who have experienced some sort of dissociative shock from a physical or emotional trauma. What are 3 good food sources of copper? A. Sesame seeds, cashews, green leafy vegetables. B. Grapefruit, pear, bean sprouts. C. Beef, eggs, apples. D. Tomatoes, bananas, rice. The answer is A. Sesame seeds, cashews, green leafy vegetables. Sesame seeds, cashews, and green leafy vegetables have among the highest levels of copper per serving. Other foods high in copper include crimini mushrooms, organ meats, shellfish, and beans. All of the other foods listed are low copper foods, often recommended for patients with disorders of copper metabolism, such as Wilson's disease. By what age should an infant be able to pull itself up to standing? A. 6 months. B. 12 months. C. 9 months. D. 18 months. The answer is C. 9 months. An infant should have the ability to pull itself up to standing by the age of 9 months. If standing is not seen after 12 months, the child should be evaluated for any type of physical developmental disabilities or delays. At what age can an infant begin eating solid foods? A. 4 months. B. 3 months. C. 9 months. D. 6 months. The answer is D. 6 months. Solid foods should not be introduced into an infant's diet before 6 months of age. Earlier introduction may trigger specific food allergies, as well as reducing breast milk production in a breastfeeding mother. An audible click when the examiner slips the femoral head forward is considered positive for what sign? A. Scarf sign. B. Babinski sign. C. Ortolani sign. D. Brudzinski sign. The answer is C. Ortolani sign. An audible click when the examiner slips the femoral head forward is considered a positive Ortolani sign. This finding suggests congenital hip dysplasia. Babinski sign is the presence of the Babinski reflex, which is normal in infants. Scarf sign is used to assess developmental age and muscle tone in neonates. Brudzinski sign is not related to the musculoskeletal system but is part of a physical examination in cases of suspected meningitis. At what age does the posterior fontanelle close? A. 4 weeks. B. 12 weeks. C. 16 weeks. D. 8 weeks. The answer is D. 8 weeks. The posterior fontanelle, which is the cartilaginous gap at the junction of the lambdoid suture and the sagittal suture, closes at 8 weeks of age. The answer is D. 8 weeks.